So we finished treating Kristen and we had her walk. And if you could tell us how you feel walking and then show us your performance of the one-legged partial squats and give us some feedback.
So walking, I definitely feel looser. I feel like I have more motion in my hips side to side. So it's a little easier to walk.
Speak a little louder, please, because the microphone is not good.
Okay, so walking, I definitely feel looser and I have more motion side to side at my hips when I'm walking. And then if I were to do a little squat on my left leg, which is always my weaker leg and the side with pain, I do that now and I feel some more muscle activation in my glute on that side. So it feels easier to do actually.
Good.
So, and then sitting, I feel definitely more even sitting as well. So
very nice. Good. Let's have you lie on your back. So I'm going to palpate the pubic bone. You can bring the camera up closer if you like. So upper pube, middle pubic joint, and now we're at the lower joint, and now that's much more symmetrical. Okay? Would you lie on your stomach, please? The ischiae are more symmetrical. I can take up the slack very easily now through the left ischium, and I can spring it and it recoils. And I did that 3 times, and now when I let go, there's a final recoil. I'm now going to spring the left ischium medially, okay? I'm going to spring the right one medially. I can take up the slack, I can spring it, it recoils, okay? And then if I spring laterally on the right, I can take up the slack and induce motion. And on the left, going laterally, I can take up the slack, I can spring it, and we have good motion. In spite of that, she still looks a little asymmetrical. A little bit improved, but still some asymmetry. And so this is a factory defect, or a factory setting, let's say, okay? So I'm not going to be able to achieve symmetry, but that's not my goal. My goal was to restore normative motion on both sides. And I now palpate into the sulcus, and the sulcus is symmetrical on both sides. So this is a presentation on a pattern which I named left lower windswept pelvis. It's not described in the biomechanical literature. It's not described on the writings of, on the literature on sacroiliac joint dysfunction. It's in my advanced videos, my advanced material, which is on my website. And the website is Hesch Institute, H-E-S like Sam, C-H Institute. And I'm so grateful to you, Kristen. Thank you very much for letting us demonstrate.
Thank you for helping me.
You bet. Thanks.